My whole entire life, I have suffered, and I mean suffered, with blood clots. Blood clots in my legs, blood clots in my lungs, mostly in my lungs. I've had at least 25 to 30 hospitalizations due to pulmonary embolism. Chronic, unprovoked pulmonary embolism. That's right, chronic. So, let's go back. Let's go way back to when I was little, actually. I would have kids come up to me at school and say, "Ew, what's wrong with your legs?" I have port wine stains going from my toes all the way up to my butt cheeks. I've had teachers ask me if I was abused because it looks like that. My legs look black and blue. One is very swollen. Actually, I am going to be 52 years old, and this right leg has gotten bigger. I'm not ready to show it. I'm still embarrassed. I have very low self-esteem due to bullying when I was younger. I just, yeah, I don't like my leg. I mean, thank God I have it on my leg and not my face. I know that there's people who have this on their face. I'm getting to the diagnosis, but there's a couple of them actually. So in '04, this was my first experience with a DVT. If you don't know what that is, it's a deep vein thrombosis. Basically, it's a blood clot in the deep vein of your leg. And if it dislodges, it can go to your lung, which it has plenty of times. So in '04, I had heavy menstrual bleeding, and the GYN told me to take the birth control pill back to back. The problem is, when I did that, I developed a clot immediately in my leg. The most pain I've ever experienced in my life, and I've been through childbirth. So yeah, that was pretty horrible. I was admitted into the hospital, put on bed rest for 2 weeks. I stayed in the hospital for 2 weeks. Of course, she has to steal the show. Don't mind her. Hi, Priscilla. Yeah, so in the hospital on bed rest, put on blood thinners. The first blood thinner I was put on was warfarin, otherwise known as Coumadin. I think I was on 8 milligrams. The normal dose is like 4 to 8. At max dose, I was on 30, which caused a bleed around my brain in the back of my neck, and I had what's called an ischemic stroke. That was in 2014. I suddenly couldn't walk. And it was very scary because the doctors looked at me and told me that even though I looked okay, that I could start bleeding and the pressure on my brain or something. This cat. Hey, hold on. Doctors told me that it could put pressure on the brain and I could just stop breathing. Or it could, I guess my own brain could kill me from the swelling. Well, obviously that didn't happen, thank God. So, after '04, I believe I was on, I'm trying to remember now, I think Lovenox, which is an injection, and I hate needles. Yes, with all these tattoos, I absolutely hate needles. Cat, chill out. Sorry. So I wasn't going along with the therapy that was recommended because I would skip the needles, because when I did do the injections, you have to do them in your stomach, and it would cause a very, very large knot, and I had really no place to go at that time. Priscilla. I was a lot thinner then also. I was like 85 pounds, and I'm now like 140. You are ridiculous. She won't stop. We're going to try to get through this video without the cat knocking the phone out of my hand. Can you stop? Okay, so Lovenox. So then when I was religiously doing it, I did develop a clot anyway. So that medicine was not working for me. They tested me for everything under the sun, and I mean everything. Every rare clotting disorder you can imagine, and all came out negative. So they had no idea what was wrong with me. So all these years, clots, in and out of the hospital. Nobody knew why. Even when I was on therapy, anticoagulation therapy, I would get a clot. You might die today, cat. Go sit down somewhere. Jeez. Stop it. You're a brat. You're not the boss of me. She doesn't like when I'm on the phone. So after Lovenox and clotting on Lovenox, I was put on Pradaxa, and that was last year. So I was in the hospital last year. I kept passing out, like at work. I was having seizures. So I was in the hospital last year, and the cardiology and the vascular surgeon people got together, and they diagnosed me with May-Thurner syndrome. Most people have their left side affected. It's compression of the iliac artery on the left side usually. Lucky me, I had it bilaterally. They didn't find that out until after the first surgery because my symptoms were still very bad. This cat. Are you serious right now? So I had it bilaterally. I've had several surgeries. I'm sorry. My train of thought is really being distracted right now by Priscilla. Okay, relax. So I had the surgeries done, and still I don't have any relief from this. And that last surgery I had, they placed a stent in my iliac artery to keep the blood flow going. Excuse you. She's tapping the phone now. I don't think this is going to work. So they put a stent on my left side and my right side, and I have been suffering. I've not been able to work. I am in heart failure. All of this is caused by all the clots that I had and the, well, here's the latest diagnosis. Klippel trenaunay syndrome. Hopefully I'm saying that right because it's really foreign to me. So remember I said about the birthmarks on my legs. So they're supposed to be birthmarks, but they're not. It's actually a venous malformation. And I have one in my brain too, which is called a developmental venous anomaly. So all the veins in my body are messed up and malformationed. So this latest diagnosis makes sense to me, and it explains everything that has been happening to me. The problem is now that I'm going to be 52, it's too late to fix things, really, because it's done a lot of damage to my heart. So now I have right-sided heart failure, which my doctor today told me is better than left-sided. And because the left-sided causes your heart to be enlarged and all kinds of crazy shit. And I have pulmonary hypertension, so I can't breathe on most days. So that's why I'm not able to work. And talk about intolerance to heat. I don't know which syndrome that's from, but it's terrible. In the summer, I can't leave the house. I actually break out in welts all over my body. I'm getting brave. Maybe I'll show you my leg. Hold on. Okay, so I'll show you. I'm not going to show you under the pants, but okay, so this is my left leg, my right leg. I don't know if it's going to show, if you can tell the difference, but my left leg is a lot smaller than my right leg. And that's what usually happens with klippel trenaunay syndrome, is the limb that is affected gets larger, sometimes longer. Thank God mine isn't getting longer. I'm actually shrinking. Not in width, but in height. Guess that comes with age, right? So anyway, so my right leg is a lot bigger than my left leg. The treatment for this, I guess I've been getting it. And I also have pelvic congestion syndrome, which is another thing that I have to get taken care of. But yeah, I'm a pretty rare case. I think it's 1 in every 100,000 babies worldwide are born with KTS. So if you are a person with KTS, I want to hear from you.